Welcome to the Train of Thought podcast. My name is Logan DeCamp, and I am a certified personal trainer and nutrition coach.
And I'm Chloe DeCamp, and I'm a certified athletic trainer.
And we are sitting down here today because we want to help you learn and grow so you can continue to do without restriction as you age.
Be sure to listen till the end of the episode so that you can get information that you can apply to your life and follow us for more.
We're live. We're doing it. It's been a while. We were gone. Yeah, I was just saying it's been a while because we were in Ireland and felt like we were gone for a month.
Mm-hmm.
We did a lot.
It was so fun. I still have dreams about it. I had a dream about it last night too.
Dreams of being in like a castle and stuff like that.
Well, that was a couple days ago. And then this most recent one, we were running around, and I think we were going to a wedding or something. And because your massage therapist is going to a wedding there, so maybe that's why.
Which is crazy, by the way.
So fun. But we were at a gas station and we were trying to get snacks. Because that was like a really frequent thing that we were doing. We were going to a gas station or one of the little stop and shops. It was so crazy. But let's not even. But like, I was panicking because I was like, I'm looking for a specific type of candy, and I really wanted that specific kind, and I just like couldn't find it because all of it was like my dream, and like none of it actually exists. But
interesting.
Anyways, it was interesting.
Dreams are weird.
Mm-hmm.
Dreams are weird.
No, it was a great trip. We were very grateful, very lucky.
Yeah, very thankful for
awesome.
your parents and being able to take us all on a family vacation there. That was awesome.
Yeah, it was great.
Definitely want to go back for sure.
That'd be awesome.
Yeah, we'll definitely have to make it possible and stay and make sure we stay in that castle for a few nights again too.
I know.
That castle is insane. But hey, we're going to be speaking on knee pain today because I mean, this is something I've seen in my practice working with people, just clients coming in because they often run or they hike or they just get some random knee pain that kind of flares up out of nowhere, and it's nothing structural either. It's just
it's not from like a specific injury, like you twisted your knee and now you have pain, or you ran into something and now you have pain. You know what I mean? Like specific injuries, like yes, going on a hike and now I have pain. Yeah, okay. That's not like, it's a little bit more of a gradual thing, but it's not like a one single instance. That's what we want to talk about. Like the one single instance type of injuries such as meniscus tears, ACL tears, or other ligament tears like MCL, LCL, PCL, and other like major structural like, tearing or, big injuries that often require like surgery and things like that. And arthritis. We are not talking towards a lot of that today. Arthritis is such a can of worms, and it's just like we could talk about that forever. We don't know enough about it yet. Yeah. It's still being studied. And so we want to keep it simple and be like, these are some of the causes of knee pain. Does that mean your knee pain is these things? No. Maybe go get it checked out. But we want to speak generally because like when Logan brought up the subject, it was, let's talk about knee pain. I was like, what about knee pain? Because there's just too many things that, can go wrong. And there's a lot of different parts, and we can kind of go through the anatomy a little bit too if we need to. I should have like a little knee model. I should have stole one from work.
Yeah.
Just kidding. I don't steal from work.
So 2 things from there. Maybe we should talk about trying to take things from work too.
Let's not bring it back up.
But 2 things there. Again, if you have structural damage to your knee, like MCL tear, ACL tear, arthritis, again, this is not for you. We're talking specifically about overuse, and this knee pain just kind of came up gradually out of nowhere because of overuse or some other things. Training. Yeah, just some things we're going to dive into in this podcast. But the second thing is the reason why this is going to be really, really valuable for you listening is because Chloe has a lot of background in this because she's a scribe for I have a stutter, things for your patients, but she's a scribe for a orthopedic that specializes in knees and shoulders. orthopedic surgeon.
Yeah.
So
we see a lot of knees, lots of shoulders. But I also have, the background with athletic training. And
yeah, you have a master's degree and all that stuff. So
seen a lot of knees. And I like the knee. That's my favorite joint.
Oh, interesting.
Yes.
I didn't know that.
Yeah.
I don't know if I have a favorite joint.
Well, you should pick one.
I should pick one. Well, we'll get to that later. But so she has a lot of background because she sees, this is something, she constantly sees on a daily basis, whether it's the knees or the shoulders. So maybe we can do a different podcast on the shoulder as well too. But
it's a lot.
It is a lot. The shoulder's even more complex.
That's why I'm
than
I want to keep everything kind of concise. Like, it's not. There's so many things that could be wrong, and we still don't even know. There's certain things that are like, oh, you have knee pain, and we can't find anything on MRI or X-ray, and it's like, okay, I don't know. Hopefully this helps, right? Like, we're still learning a lot about knees, and especially learning a lot about arthritis and like all the different presentations of that. So, let's kind of.
Yeah.
What do you have some points you wanted to touch on? So.
My kind of thought process here that we're going to kind of do here for this podcast is I'm just going to kind of go over a analogy that I often seen in my experience being able to work with people these past 5 years when it comes to pain that just kind of gradually came over time. Like, for example, I had a client last week. He texted me this week and said he had some knee pain because he got back into being able to run again, and he ran like 9 miles. And
like out the gate.
I know, right? I'm like, well, no shit, you got some knee pain going on, dude. You got to gradually work back up to it.
I can only do maybe like a mile.
Well, sorry, he did 3 miles one day, 3 miles the next day. So like a total for the week. Yeah, total for the week.
That's a lot in a week.
And
for your first week.
Yeah, well, he's ran in the past, so
no, I know, but
most people think they can just kind of get back into it, and that's why like a lot of people get hurt with running as well. Like, oh, I did it when I was 20, and I'm just going to go run again, right?
Yeah, totally.
So he was dealing with some pain in the side of his knee, which is most likely his IT band, which we'll dive into, or something else. But there's a analogy that I heard from Mind Pump, and it's this podcast, and it's really, really stuck with me. And what Mind Pump is it's 3 trainers. Each of them have a combined 60 years of experience being able to work with people as personal trainers. And the analogy that they use that really, really stuck with me is we have to think of the knee kind of like a sliding glass door. So when the door opens and closes, that's like what your knee does. It flexes and it extends, right? And in a perfect world, whenever there's no mobility restrictions in your hip or ankle, because that is where your knee attaches, either at the ankle or the hip, right? Like,
well, yeah, there's attachments of muscles from the hip to the knee, and then there's attachments of muscles from the ankle to the knee, like, back and forth, right?
Correct. So, yeah. So
that's what you're trying to say.
Yeah. So
it's all interconnected, and the mechanics kind of follow along that.
Right.
Kinetic chain is what it is, I think.
Yeah. But anywho, if we use that and we think about the knee from that standpoint, it only does 2 things: flexes and extends. Right. But whenever there is tightness or a restriction in your ankle or hip, it's now pulling on those muscles around the knee, and your sliding glass door no longer opens and closes the way that it's supposed to. Now it's grinding on the tracks as you open it and close it, because there is a mobility restriction in the hip or the ankle. And to give you some examples here, I do have some notes here, but let's say for example, you're lacking external rotation in your hip due to a piriformis or your glute maximus being tight, or you have a tight calf causing a inability for you to track the knee over the toes. In this case, regardless of the example, that sliding glass door is no longer tracking perfectly as you open and close it, flexing and extending the knee. So oftentimes in my practice working with people, I've seen that if we can really get more mobility, which when it comes to mobility, it's not just you have to stretch. It's proper range of motion, strength, a stability and control in those ranges of motion. That's what proper mobility is. And if we can work on that in the hip and ankle, often 9 times out of 10, I see that knee pain gradually goes away.
Totally. Yeah, so I mean, we learned this in school. Like, there's certain angles of, it's called a Q angle, in terms of like the angle at which your hip and knee and ankle kind of line up. And then the, kinetic chain of like how everything is, interconnected. So a lot of the time for these chronic pains, these, this knee pain that kind of shows up after you do a lot of activities like running or jumping or frequent squatting, lunging, like a lot of stuff often when we're like just starting out. But it can also happen when we've been lifting and doing things for a long time and now maybe something changed. You got different shoes. You haven't been doing your glute, mobility and work, at the hip or something. And now all of a sudden, oh, I'm getting knee pain. What the heck? I don't understand that. But, these are the things that we're talking about because I just want to, preface that because I'm going to go through a couple different, diagnoses of knee pain, like different things that kind of pertain to this almost overuse style injury to the knee. And so I'll kind of go into that. Anything else you wanted to say?
No, I mean, you kind of hit the nail on the head. And what you're going to do here is kind of talk about some things you see in your office that come through time and time again. Yeah. That was a big yawn there. You need to get you some coffee or something.
No, I just had pre-workout.
Oh, okay.
I want to start with a little bit of an anatomy lesson because I can just like explain everything in terms of, oh, this is this at the knee, this is it. If you don't fully understand like where things are in the knee, you may not be able to say, oh, that sounds kind of like my issue, right? Because it's kind of vague, right? So, and 3 main bones that are at the knee is your femur, your tibia, fibula, and your patella. So your femur is the big long bone at your thigh. Your tibia is the big shin bone. And then your tiny little baby fibula is on the side. And then your patella is your kneecap. So you have a lot of muscles all around it. I'm not going to tell you all of them because honestly, I can't really remember all of the ones at the ankle and the calf or whatever, right?
There's a lot.
But there's a lot. So like at the upper part, the ones that are near, on your quads and your hamstrings, I'll keep it vague. Quads and hamstrings. Quads are on the top, right? In your front of your leg. Hamstrings are in the back. You also have your IT band, which is on the lateral side of your leg. Mm-hmm. It attaches to a muscle called the tensor fascia lata. Super fun, TFL. And I'll get into that one a little bit. That one's a kind of a interesting injury, and it really, people don't really think about it too much, but people talk about IT band all the time because they love foam rolling it, which I'll talk about. But that attaches down at the knee as well, along that big old fascia, length of the IT band. Then you have adductors too on the inside medial side of your leg. They also attach down at the knee. They call, there's some of them that attach at the pes anserine. It's kind of the medial area. They're kind of like this 3 little whatever. I'm not going to get too into it. I know, but I'm just, I'm saying that's medial, IT band's lateral on that outside inside. And then you also have ligaments in your knee. Or backtrack, your muscles, your quad muscle attaches to your patella through a tendon called your quadriceps tendon. And then your patella also is attached to your tibia by your patellar tendon. A lot of people kind of, you can split them up because they're kind of separate tendons, but technically it's kind of confusing because technically the patellar tendon is what's attaching the quad all the way to that tibia and creating that movement joint, right? Because without it being attached to the patella, to the tibia, your knee wouldn't be able to move, right? Same with the quad, technically. If that was to be, injured or something, you still wouldn't be able to move your knee. But so those are two big ones. I'll also talk about injuries to those because those can often be like a chronic use injury. The patella sits, between those two bones, like I said, and it helps with some gliding. It works as like a little gliding mechanism so that we can bend our knee with, smoothly. But there's a lot of things that can happen there that can cause our knee now to have pain because of where it sits and how it's gliding and all of that. So I'll also talk a little bit about that. Then you obviously have all your ligaments. ACL, PCL cross over each other and they're in the middle of the knee. And then you have an MCL, medial ligament, and an LCL, lateral collateral ligament. So I'm not going to really talk much about those. Those are often injured with bigger injuries.
Yeah.
Can be irritated sometimes from overuse, but I'm not going to really go into that. ACL injuries are really interesting, but not going to go to there.
Right.
Then you also have meniscus that are kind of our shock absorbers. They sit on the tibia and they work as a little shocks basically for our knee. They can often get injured. Also not going to talk too much about that. And then there's cartilage covering all of those ends of those bones. So think about like if you see the pearly white, surface of like chicken bones when you're eating wings and stuff. The pearly surface is going to be that cartilage, very similar to like what our knee has. And that can get damaged, and that's arthritis. So easy.
Yeah.
Simple.
And we didn't even dive into all the muscles, guys.
No,
so,
and keep it vague, right? But
yeah, definitely need to.
Easy.
It definitely can get complex if you try and dive into the weeds. But no, that was good.
But that's pretty much the knee. It only flexes and extends, like we said.
Yeah.
If you're doing a little rotation, there's a little bit of give there, but there's not a lot because that's what your ACL and PCL are trying to prevent, any kind of like sliding of those tibia, femur and stuff, and all of those ligaments are holding everything together. When we do over twist, that's when things kind of can go wrong, right?
That's when you get some structural damage.
Yeah. So I first want to talk about patellofemoral pain syndrome. Specifically, syndrome is the definition of a syndrome is a group of symptoms which consistently occur together or a condition characterized by a set of associated symptoms. Syndrome can be kind of a broad array of symptoms that can categorize into that location. So that's what this is saying. Like any kind of like injury or pain or things like that related to your patella and the femur and the way that it, is gliding, or the injury to that area and where you're having your symptoms is just kind of funneled into this little category. So what can this look like? It can be pain that's worse with squatting, lunging, stairs. You can get achy pain from sitting in bent position for long periods. So that one can also kind of cross over into the arthritis too. So, but essentially, patellofemoral pain syndrome can often be an overuse injury. The way that when we squat past 90, our patella, not to get crazy into it, but our patella kind of, the way it sits on the femur, it can grind and, cause issues if it's being pulled one way or the other by other muscle imbalances. And so that can cause pain because now it's not gliding so perfectly in that little notch of that femur.
For example, if people's hip flexors are tight, now that patella is not tracking
now it's not tracking perfect.
Yeah. And so many people have tight hip flexors too because we're more sedentary than ever. So if you try and go into a squat and you have the patella not tracking the way it's supposed to.
It can be from quad weakness too.
Yeah, and
I can speak to that because I know that I have this issue and I've been kind of trying to fight it because last season for skiing, I was like almost in tears coming off the mountain one time because my knee hurt so bad. I was like, what is going on? And I was able to pinpoint it just because I kind of knew what was going on, towards like patellar pain and like right underneath that patella. It's usually pain that's like towards the front of the knee because that's where your patella sits, right? And ever since then, I mean, even in the off season, I could probably have done a little bit better, but I'm really like determined to, keep up what I've been doing this last season. I had way less pain. I had way less issues, but I focused a lot more on adding quad strengthening and focusing on my form and doing better about like really focusing on how I'm doing my lunges. And I don't squat very often, but when I do, making sure that my form is good and, being careful about that. So, quad strengthening and, never neglect any other muscle groups in that, but those help a lot.
Yeah, like again, going back to proper mobility, because one other thing that came to mind too is if you're lacking range of motion in your ankle into, not to get complex, but we'll just say your knees going over your toes. There's a specific name for that, but we'll just keep it simple. But when your knee, it's supposed to track over your toes so many, up to a certain point of degrees.
Yeah.
And when you're squatting, and if you're lacking range of motion in the ankle, I'm assuming that's going to cause the patella not to track as well too,
Probably.
which is going to cause pain. So it's not only just in the hips and at the quads and the hamstring, but we also have to look at the feet as well too and see what the ankles are doing.
Yeah. So a lot of the times if you have more pronated feet, so flat feet, that can kind of put you a little bit at higher risk of your patella being a little bit malaligned and kind of, off center. And that can also lead to a little bit of this too. So there's a lot, once again, syndrome. It has a lot of things that are all kind of like, here's that umbrella term, and you can fit into a lot of that. And there's a wide range. That's where for any of these things, honestly, having somebody take a look at you, make sure you're doing okay. If you're working with a coach, bring it to their attention and be like, hey, this doesn't feel great.
Right.
If you're not working with a coach, maybe go see a PT, go see a surgeon or, even sports medicine doctors and, get to a little bit of a root of it. Because if you keep going and keep irritating it, I mean, in this case, you could be wearing out your cartilage in the knee. You could be, leading to some, progressed arthritis, right? And you can just keep having constant symptoms, and that's no way to live your life. You got to figure out what the root cause is here. And so getting somebody on, hands-on, being able to figure out what your issue is super helpful.
Yeah. And I mean, this is why we also do a movement screen for like all our members when they come in.
Which is awesome.
Because it's super important for proper workout programming, especially for our members online as well too. Because I mean, I can make a workout program for you, but I got to know what your movement looks like so we're not continuing to run into problems down the road.
And that's really smart to do because, I think a lot of coaches and a lot of people will just start doing stuff just because, I saw it online or that's what my program says. And they're not doing it with correct form, or it's just they have some underlying issues and we just jump right in and go full 100, and now we're suffering because of it because now everything hurts.
Right.
So moving on.
Wanted
to talk about patellar tendinitis and quadriceps tendinitis. So going back to where the quads insert, and attached to that tibia. So there's quad tendon that's above the patella, above the kneecap. Patellar tendon is under the kneecap. Patellar tendon is one that really is more common than I'd say quad. But it can show with pain, swelling. It's really tender over that tendon if you touch it. Often comes from a lot of jumping. This is often called jumper's knee.
Interesting.
Pain with physical activity or exercises, that can progress into more consistent, like constant, everyday type of pain. So it's not one I would ignore, because once again, it can be leading you to some, you maybe have some weakness of the quads, your hip flexors are tight. So pretty much everything there. But once again, kind of a different pinpointed area. So it doesn't necessarily fall into that patellofemoral pain. It's falling into that patellar tendinitis because that tendon is irritated. Tendinitis is just irritation of the tendon or inflammation of the tendon. That's literally what the word means. And so that tendon is irritated and annoyed. And if we progress and keep going on it, we can get tearing and slowly, more and more tearing. And to tear that fully would be really sucky because it's not a fun surgery to recover from, just so you know. And do not get injections in your patellar tendon or your quad tendon, in the tendon itself. Just don't do it.
Why?
It can weaken the tendon, especially if you do it regularly.
That makes sense. I remember you telling me that.
Not worth it. There's other ways. There should be other ways. There's actually, I think, one of the really good ways of kind of helping out with quad and patellar tendon is using instrument assisted. What is it? Instrument.
It's okay.
Whatever. Grassing, like, the massage technique with the. Wow, I am losing it.
You're talking about the one where, like, you scrape the
tissue? Scraping and stuff.
Yeah.
I-stem is like the way that is like the fancy way of saying it. Soft tissue mobilization. There you go. Instrument assisted soft tissue mobilization.
I've often seen when it comes to
scraping can help a lot, especially for certain instances. So make sure you're talking to your physical therapist or doctor before you start just like, oh, I'm gonna go buy one online and start scraping myself. Probably shouldn't do that unless you knew what you were doing. So.
I was just gonna say, I've often seen when it comes to the quad tendon being upset, I've seen that just getting your quads really rolled out and stretched can help a lot.
Definitely
with your quad tendon and kind of take some of that pain off.
Definitely, so really good stretching techniques, focusing on really good strengthening is awesome. Anything that's going to strengthen your quads, because a lot of the time, because now we have that hip flexor tightness, it doesn't, just because you want to stretch, but you also don't want to neglect your strengthening, right? Because if we're stretching, but we're not strengthening it, what's that really helping, Because, so that's a really good point.
Cool. IT band syndrome.
And then I wanted to say patellar tendinitis can happen a lot with runners too, just because of the impact and stuff.
That makes sense.
IT band syndrome.
Well, hold on. Can we go back for a second?
What?
When it comes to patella tendinitis, can that alleviated by rolling out what's the tibia? Or not?
It's not attached to anything in terms of muscles that are at the, calf or anterior tib and stuff like that.
How would you alleviate
that's great tendinitis? To do still, roll out your calves and do all of that because it's probably really tight. And then, like we said, everything's interconnected. Yeah. So, like, if you loosen that up, you loosen everything else up. Great. But remember that the quad goes into the quad tendon, crosses over that patella, and now it's patellar tendon attaching onto your tibial tubercle on the tibia. And so that is like the whole, so it's actually the quads that it's attached to, technically, through the quad tendon.
So to alleviate
patellar tendon,
you would roll out your quad.
Okay, you would want to do a little bit of that. I mean, like you said, everything's interconnected. So doing some of that, the ankle and the, doing that. Look at the foot, same thing. If you're pronated, supinated, things like that, that can also put a little extra tension in that area. So once again, we're speaking so broadly about all of this. There's so many things that can be going on, and that's why talking about knee pain can be kind of hard.
Right.
But hopefully this is getting a little bit of a better idea.
No, yeah, definitely is.
IT band syndrome. Next, I talked about it a little bit before. The IT band is a big swath of fascia. It's kind of crazy, like how strong it is. To be honest, it's like a very tight, strong piece of fascia. It's attached to that muscle, TFL, tensor fascia lata, and then it attaches to the Gertie's tubercle, because that's kind of a fun name. At the tibia. It's lateral. So a lot of times this can happen a lot with runners. This is one of the more common things for runners because they neglect a lot of the hip imbalances or mobility issues there. So make sure, we want to address that for sure. But it shows up as lateral knee pain usually, so the outside of the knee. It can get worse with activity. It can include feelings of snapping or popping on the outside of the knee because the end of it, of the band, can snap over the condyle of the femur, so the outside of the femur bone there. Just snaps and pops over back and forth, which can be really irritating and really annoying and can also, exacerbate the symptoms. Can be warm, red, and you can also experience a lot of hip pain along with that knee pain.
Interesting.
So you've probably seen some of it, right?
Yeah, I've definitely seen it. Now, the controversy here, though, is we don't necessarily want to roll the IT band, from my understanding, because it is a kinetic tissue. So
if you were to try and stretch the IT band by rolling it out, you need a steamroller. That's how strong and tensile it is.
I mean, I put a barbell on my side,
but you're rolling. There's muscles underneath.
Yeah, like your vastus lateralis, which is part of your quad.
Right underneath.
If you go high up enough, probably rolling a TFL as well.
Yep.
And I've saw just rolling out those two muscles alone can help take the pressure off
Definitely.
that IT band.
Definitely. So not to say that foam rolling is the worst thing you can do or anything. It's still helping. But are you rolling out your IT band? No.
Yeah.
You're rolling out the muscles that are around it and the muscle that it's connected to.
Yeah. And I think for those two muscles I stated, like your quad and that hip, you need something stronger than a foam roller. I've often seen. I mean, of course, people are different, but those are some really, really
it's also very painful, though.
It is painful, but
it hurts to roll out your IT band area.
Yeah. But those are very strong muscles, and I feel like you need something stronger than
sometimes
a pool needle. I mean, that's kind of what a foam roller.
It's a little harder than a pool noodle.
I mean, it kind of depends on the one you get, but the ones that are really soft.
Well, the brand new ones are hard. I'll tell you that.
But yeah, that can definitely be something. But
something that you can do as well with that, to be able to target that TFL, the tensor fascia lata muscle that the IT band is attached to, is taking a golf or lacrosse ball, putting it right in that hip, right where your pocket would sit. That's where that muscle is. And if you press on it, mine's really tight and that kind of hurts. And then you put that golf ball there and lay on it and just kind of roll over it. You'll feel it.
Yeah.
You'll feel it for sure. So that, once again, complex, lots of things involved. It can be, ankle mobility, hip mobility, all of that issue, high loads, things like that.
But it's important to keep in mind, if you're rolling it, that's just a Band-Aid. We need to also adjust mobility, strength, range of motion, your stability, and control as well.
Totally. Yep.
So, cool.
My last little bit, this one's not necessarily as chronic, but it can be, is bursitis. So that can be, that name is kind of thrown around a lot, bursitis. We have little sacs of fluid in our joints, and they help basically lubricate the area so that when we are moving, nothing's rubbing super hard against each other, and the skin's not rubbing on tendons and muscles and things like that. So it's just this big helpful lubricator, right? So there's one on the very front of the knee, or prepatellar bursa. That one can get really irritated and swollen and red and just pissed off if we're doing a lot of kneeling. volleyball players, if you're diving with your knee pads even, like even just jumping and things like that, it'll just come kind of out of nowhere. But a lot of the times it's from like an actual hit, right? So like it'll hit it and then now it's blown up. So it's swelling, but it's not swelling of the knee necessarily, the joint, because that's separate because it's its own compartment. It'll be swelling kind of on that top part of your knee. That often, like I said, repetitive activity, swelling, pain, warmth. So this one's just a little bit different, but you can also get it over where those adductor muscles combine and come into the knee, the pes anterine.
Interesting.
That can often be from like overuse because it's just rubbing a lot or, just super irritated. And now that person is like, I'm annoyed. So some of this can be overuse. Some of it can be from direct hits and things like that. The similar, we just want to be careful in terms of, maybe decreasing what we're doing, let it calm down, go see somebody if you're worried about it and it's not going away. And it can be pretty painful to the touch too. And then, what was I going to say? Same as everything else, address any kind of mobility, weaknesses and things like that.
Yeah. That was, I hope those that were listening in got their notepad out because that was like a masterclass on some overuse.
That's not even everything, you know what I mean?
But those are like the most common ones, though, I feel like.
Those are more common,
so,
yes. Yeah.
Well, cool. The last thing I was going to have you speak on, because I've asked you about this before, because I often have clients come to me and they're like, I have this knee pain and I throw a compression sleeve on it. And for some, it can help alleviate pain. For some, it doesn't. What are your thoughts on a compression sleeve for knee pain?
Definitely. So it's not necessarily going to hurt anything. So if it's helping you, great. Go for it. Use it. Compression is one of those things that help for any kind of injury, right? So icing, rest, ice, compression, elevation, rice is like what we learn in school, right? And there's controversy about that. Whatever. I'm not going to go into that. But compression helps specifically with swelling. So when we compress the area, it pushes that swelling out of the area is the idea behind that. So for some people, if you are having knee swelling, great, throw on a compression sleeve. If it's not necessarily swelling, you want to throw one on and it does help, great. But is it adding any kind of stability to the knee? No, because it's just compression. It's just fabric. It's just tight fabric. What we would, if you are having stability issues, if it feels like the knee is kind of like unstable, a hinge along with compression is more desirable in that case. But oftentimes bracing isn't the answer. It's kind of a band-aid, right? It can help us for a short term, but it can't necessarily be used for a long term for like especially these chronic issues. For any of these chronic issues that I spoke towards, a knee hinge brace probably is not going to be any help. If you're getting swelling, a compression sleeve is great. But
gotcha.
A sleeve can also help kind of with that mind-body connection a little bit. Be like, hey, this hurts. Maybe just back off a little bit, or, just so that you're a little bit more aware, because it's the same concept as like the KT tape. I'm not like once again, I'm not going to get into it too much, but it's the idea of something being on your skin and that tells your pressure sensors and your sensors in your skin, hey, something's here, right? Tells your brain, goes up to your spinal cord, tells your brain that, hey, I have something on me, basically. And you're more aware of that location is the basic idea from my understanding, at least with the tape, and help with compression, right?
Yeah.
And so in some cases, yes, but is it the answer? No.
Makes sense. It sounds like if it's a swelling, it'd be good to put it on. Or also if you're somebody like me who often struggles to back off sometimes. Putting it on can just send a gentle reminder to me that like, oh, hey, we need to be more mindful about this.
Definitely. Yep,
So,
for sure. But
cool.
It's a Band-Aid, not our answer. So hopefully this was helpful. I could probably talk about it forever.
It was really helpful. I hope those that were listening in got their notepads out. We talked about a lot today. If you want to, take a movement screen, I'll be more than willing to send you over a movement screen, and then I give you a response back of some ways that you could improve. Because again, like all of this we talked about today goes back to lack of mobility in the hip or the feet or that word's hard all of a sudden, but the hip, feet, or ankles. So if you want that movement screen, just send me a email at logan@champ-camp.com. All that information is down in the show notes below. But if you have any other questions, comments, or concerns, please feel free to leave it down below in the show notes, and we look forward to seeing you on the next recording.
Yeah.
All right. Bye.
Bye.